We are grateful for your presence too, Doctor. Every week you have something very, very, what we would say, what things to quench the sips that we all wait for. So over to you, Doctor.
Thanks, Burley. Always a pleasure to come back, and I look forward to the Mondays. And Tony has really set the stage. I love that song. I love the energy, and I think that that should be an infectious energy that everyone should catch on. And that's the spirit of the Magic Monday. So I think we're doing extremely well. Thanks for everyone for coming here. And May has been a day, as Buddy said, we have Statehood Day coming up. There are many days or health days that we observed in the month of May. This time for the SIP, I thought I'll talk of something very special that's related to cognitive decline, which happened on the 25th of May. Anybody knows what happened on 25th of May? There's a clue in my background. What's that? Okay.
Larynx.
Larynx. Okay, something, the part in pink.
Depends where you look. Tonsillitis.
Tonsils. No, that's not the tonsils.
Thyroid.
It's a butterfly gland, Nadia. Exactly, that's the thyroid. World Thyroid Day. 25th of May was World Thyroid Day. And it's an important hormone that is required for us for various functions. Now, if there is less hormone, you get hypothyroid. And there's more of the thyroid hormone, then you get hyperthyroid. I'll be talking today about hypothyroid. Very often in our clinics, we have patients who come and say, Doctor, moja nozo. I think it's very nicely, it can be captured in that in Konkani, nozo shadistamaka. And if we do their test, we realize that they are having hypothyroidism. Or, you have children coming with their parents and saying, mom's so tired. And if you do the test, you suddenly realize that this is a problem that has taken place in them. Thyroid, the signs of thyroid sometimes, or thyroid problem or hypothyroidism sometimes can just be missed because it's just like things that happen in normal aging. So I thought I'll just tell you by talking about another mnemonic. And as people complain, mom's so tired. Let's see what mom's so tired means and whether that can actually capture whatever happens in people with hypothyroidism, less thyroid hormone. First one is M. M stands for memory loss. So you have memory loss that could be associated with hypothyroidism. Remember this because this is one of the treatable causes of dementia. Most of the causes of dementia cannot be treated, like Alzheimer's disease. There is no cure for it. We have medication, but no cure. But the hypothyroidism is one of the causes for dementia that can be reversed. We have to detect it early and we have to give treatment and we can reverse it. So memory loss is the first sign of hypothyroidism. Second sign is obesity. People will start putting on weight, and that could be a sign of hypothyroidism because the thyroid hormone is low. There could be weight gain in that individual, and so we need to check out on that. If you do the blood test, the lipid levels also could change. The third is menstrual problems. So there is menorrhagia. This excessive bleeding also could be related to thyroid. S, M-O-M-S. S stands for slowness. Slowness could be mental slowness. You take a long time to give an answer. You'll be very slow when you're thinking, or it could be physical slowness as well. So they'll be very slow in walking or doing things. Think that they're doing very quickly, running around and very light on their feet. They'll be very slow now, and that slowness will be noticeable. And if you do their test, sometimes they could be having low thyroid hormone. So memory loss, obesity, menorrhagia, slowness, M-O-M-S, moms. I said moms so tired. So the next S is skin dryness. You'll have dryness of the skin. So our skin has a little amount of oil in it, which is why it is like nice and shiny. But if you have hypothyroidism, the skin can become dry, and dry skin can sometimes be itchy and some people will scratch. So that is skin dryness. Your hair will also become dry. So you lose that luster of your hair, the shine of the hair, and the hair will look very dry and dull. It could be a sign of hypothyroidism. So we need to keep that in mind. So that's O. O stresses the fact that the onset is going to be very gradual. It's not going to be something suddenly that happens overnight. It's not like some infection that you got. It is something that has happened over time and slowly. First, the TSH gets secreted from the brain, and the brain stimulates the thyroid gland to stimulate the production of thyroid hormone. But once that cannot happen, then ultimately it gives way and you end up seeing all these signs and symptoms. But so its onset is going to be very gradual. So that is S and O. The last bit, which is tired, And the first T stands for tired itself. So people with hypothyroidism will feel tired. That's one of the signs that they will come and present to you with, nozo, काम करून शे दिसना, खूप फ्राक शे दिसता. So that is the kind of complaints they will come up with. So tiredness is the first thing. I stands for intolerance to cold. So people could otherwise tolerate cold. Now in the normal they would use an AC and stuff, but now you put an air conditioner on and they'll say if it's too cold, just shut it off. So intolerance to cold could be a sign of hypothyroidism. R stands for really low blood pressure. So blood pressure drops. It could be a sign of hypothyroidism. E is energy is low. Energy falls as the total energy in that individual falls. That is the E. And D is depression. So hypothyroidism could end up in depression. If somebody is depressed, does not mix up with people, does not talk much, crying sometimes, cannot pay attention to things, cannot concentrate. These could be signs of depression. But the cause for depression could be a low thyroid hormone. So one needs to keep that in mind. So keep in mind next time mom's so tired and all these, what it stands for, memory loss, obesity, menorrhagia, slowness, skin dryness, onset, which is gradual, tiredness, intolerance to cold, really low BP, energy that is very low, and depression. So these are the signs of hypothyroidism. World Thyroid Day, we need to raise this awareness and let everyone know about that and stay fit. Thank you, everyone.
Thanks, doctor. As you say, all of us here are mums, and very tough. Often we may be the mums who are so tired. So thanks for that warning bell. I think sometimes it's better. Awareness is better than just taking us, suddenly. So I think these are the symptoms and signs which we should be looking forward to. And thank you so much for sharing that with us.
Pearly, could I
Yes,
ask
Maridel.
a question,
Yes, doctor.
Doctor,
Yes.
do we look for all these symptoms to suspect that there's hypothyroidism?
No. So one, it tends to become like an iceberg disease. So most of the thyroid cases go undetected. And if you see all these symptoms, for example, obesity or slowness or dryness of the skin, you never know when that could be a sign of a disease, because that normally happens in a lot of people and we tend to ignore these things. So any of that, especially an older person comes with any of these complaints, we should do a thyroid function test once. We do T3, T4, and TSH. The TSH in hypothyroid goes up. Okay, so this people make that mistake sometimes. The TSH, the thyroid stimulating hormone, goes up, and that is hypothyroidism. So you need to detect that. So any of these symptoms with a high degree of suspicion, we need to think about thyroid problems as people grow old and do the test.
Thank you, doctor.
Yeah, I know. We don't have to fear. Dr. Amit is just a call away.